Yes, ma'am.
Yes. Okay, started the timer and here is the question. Yes. So if you have read and understood, kindly begin your history taking station.
Yes, ma'am. I'll enter the room. I'll wash my hands. Hi, my name is Dr. Sridhar Murli. I'm one of the junior surgical doctors here today. Can I confirm your name and age, please?
Yes, my name is Tom. I'm 42-year-old.
Hi, Tom. Nice to meet you. Can I ask what brings you to us today? Can I ask what? How can I help today?
Yes, I have a back pain.
Okay. How long? Can you explain a little bit more about the pain? How long has it been going on for?
Yes, doctor. I have this back pain for last 4 years, but I don't
Four
know what
years.
happened. Yeah, 4 years, but I don't know what happened. Since yesterday, the pain is increased.
Okay.
I couldn't really sleep well.
Okay. And can you explain to me exactly where is the pain specifically?
Here in
Back
lower
in the
my
lower
back,
back or in the entire back or
lower my back.
on your lower back? Okay. And you said it's been going on for 4 years. How would you describe the pain? Is it like an aching kind of pain or
Yeah, aching pain.
aching kind of pain? And does it go anywhere else in your body? Does it radiate? I mean, does it go to any other parts of your body?
Yes, before just in my back. Now, since yesterday, the pain is to my leg also, both of my legs.
Both your legs also.
Yeah,
And
and bum shake.
and your bumps as well. Okay. And what about the timing? Is it like a continuous type of pain? Is it always present, or is it
Yeah,
present only
yeah. Since yesterday, the pain here is not relief, not
continuously
gone.
present?
Yeah,
Do you think that anything that you do aggravates the pain? Do you feel that anything that you do exacerbates the pain?
pain it is increased with the movement, any movement. The pain is increased. I don't think anything's carried.
Sorry, hello.
The pain is increased with the movement, with every movement, and
And anything else that you
nothing
do can.
relieve this pain.
Sorry, I didn't get that last time. What
Not nothing,
to relieve the pain?
nothing decrease the pain.
Okay, I'm so sorry to hear that. Do you have anything else associated with the pain? Do you feel any other problems, or is it just the back pain at all? Do you have any other
Yeah,
complaints?
yeah. I couldn't open my bowel. Also, I
Are you
couldn't.
having difficulty in opening your
Yeah.
bowels?
Also, I have a problem with my water wall.
So tell me about your bowels. How many days have you not opened your bowels?
Usually I open my bowel every day, but
Yes.
since yesterday till now, I didn't open my bowel.
Okay, I'm so sorry to hear that. And what about your waterworks? Are you having difficulty in urinating as well right now?
Yeah, I have a hesitancy to start urination, and I can't pass well
Okay, and
my
is
water.
that since yesterday as well, or is it since going
Yeah,
on for
yeah,
a while?
yeah. Since
That is since
yesterday.
yesterday as well.
Yeah.
Okay. All right. Are you having any difference in your sensation of your legs recently? Are you having any alteration in sensation at all?
I have a needle and numbness on my palm cheek.
Okay. What about are you having any numbness along your legs at all?
Not all my leg, just to my thigh.
Okay. And do you feel any weakness over your legs at all? Do you feel any weakness?
No, no weakness.
No weakness. And are you having any fever or any other symptoms other than that?
No, no.
Okay. Do you have any loss of weight or any loss of appetite at all?
You mean since yesterday or?
In general, I'm just asking in general some of the
No, no,
questions.
no, no, no. I'm well fit.
Okay. And do you have any more stiffness in the back when you get up in the morning at all?
No.
Okay. Right. Now I'd like to ask a little bit more about your past medical history. Do you visit your GP or are you in any medication at all for anything?
Actually, I tell you this, for 4 years, I take a painkiller for this
For
pain, not regularly.
okay.
When the pain is come, I
Intermittently
just,
for the pain. Any other
yeah,
medication that you're
paracetamol.
on at all?
No, no,
And are you allergic to any medications?
not as I remember.
Okay. And have you had any surgeries in the past?
No,
No. And what about any history of similar illness in the family?
no, no,
No.
nothing.
Can I ask a little bit more few personal questions, please?
Yes, yes,
Are you currently working or?
yes. I
Okay.
have office work.
Office work. Is it desk job? Yeah.
Yeah,
Okay. And are you currently married? Who's at home with you?
I'm married. I have 2 children.
Okay. And do you drink or smoke?
Yeah, I smoke 10 cigarettes per day and drink 1 glass of beer every day.
Okay. And do you have any history of any recreational drug use at all?
No, no.
Okay. Right. So do you have any idea as to what's happening? Do you know what is wrong with you?
I don't know exactly what's happening, but I'm really afraid because I didn't open my bowel. I don't pass my urine well.
And what is any other concerns that you have? Do you have any other concerns other than this?
No, not exactly.
Okay. So thank you very much. I'll get back to you. Okay.
Thank you.
Can you present
Right.
your case now?
Yes, ma'am. So today I had the pleasure of meeting a 42-year-old gentleman who's currently working and he's come with the history of lower back pain since about 4 years and aggravated since the past one day. He gives a history of radiation of the pain back to down the bottom up to his buttocks and down his legs. He also gives me a positive history of hesitancy while urinating and constipation since the past one day.
So what are your
Um,
provisional diagnosis?
Considering his history, my provisional diagnosis, I would consider the radiation of the pain as well. I would consider maybe a prolapsed intervertebral disc, functional back pain, or a spondyloarthropathy or spinal canal stenosis.
Okay. Can you tell me what are the red flag symptoms which can
Yes, ma'am. In a patient with a back pain,
indicate?
I would be
Yes.
concerned about any urinary or fecal incontinence or any sensory loss of the buttocks area and the back, any weakness of the legs, as this can indicate CAUDA equina,
Yes.
which is an emergency.
So what investigations would you carry out to confirm your
So
diagnosis?
first, I would complete a full examination to get a proper detailed history and put a full neurological examination of the body, including a proper digital rectal examination to check for the anus sphincter tone. I would check for the reflexes as well. Then following that, I would do routine bloods, and I would like to get a chest X-ray and an MRI scan of the spine.
So what should be the
Urgent.
treatment options that you can offer to this
Ma'am,
patient?
first I would like to confirm the diagnosis. If it's just simple back pain, I would try to treat it conservatively with medical management with painkillers and offer surgical treatment only if there is any surgical complications. If it is a CAUDA equina syndrome, that I would refer the patient to urgently to a neurosurgical unit and treat it as an emergency as the ABC according to CRISP protocol, and refer the patient to neurosurgical unit.
Yes. Good. Thank you. Yes. Thank you. Okay. Good. It was within given time. And Dr. Z, do you want to give feedback?
He do it well. He
Yeah.
really ask about everything, especially the warning sign. It's
Yeah.
important, and he just forget about the trauma. if they have a trauma recently.
Trauma.
Yes,
Yeah.
okay, yeah.
Trauma. Yeah. Okay.
Trauma and maybe if back pain. Yeah, but he did ask you if it becomes worse, when it becomes worse, or if it radiates
Yeah, I
anywhere.
ask everything. I think
Yeah,
even the warning sign. I'm happy to hear that he
yeah.
exclude it because he didn't ask about trauma.
Okay, good. Yeah, if you lifted any heavy thing or trauma, okay, good. Thanks.
Right. Trauma.
Timer,
Yeah, okay.
Yes.
here is your question. If you have read and understood the question, kindly begin your history taking session.
Good morning.
Morning.
My name is Dr. Zaid. I'm one of the surgical doctor on the clinic. Before I'm here to take a history from you. Before I start, could I confirm your name and date of birth, please?
My name is Esther, 43 years old.
Nice to meet you. How can I help you?
So doctor, I've been having this leg pain for the past weeks, and then it's been really hot in these days. And then yeah.
Oh, I'm sorry to hear that. Could you explain for me more about this pain?
Yeah, so actually, what do you want to know about the pain, doctor?
When did this pain start?
Okay, so the pain actually started, let's say a couple of weeks, but for the past 2 days, I've been having this severe pain. Yes.
Okay, before 2 weeks, you are well, you don't have this pain.
Yes, I've been fine.
It starts suddenly or gradually.
Yeah, it was of a gradual onset.
Okay, since you have this pain, the pain is increased or the same.
It's increasing. It's been increasing. It's like it's really severe now.
Okay, could you describe the pain, please?
Um, like, what do you want to know, doctor?
Is cramping, is shooting like, or
Yeah,
just
it's
discomfort?
shocking. Like,
Shooting.
yeah. mm,
Um, could you point out where is the pain exactly?
The pain is all the way on the back of my legs, going all the way down to like down to my foot.
Did you have any pain in your back?
Yes, I do have pain in my back as well.
Anywhere else, back and your legs and
Mhm. Apart from the back of my leg, there's nothing else.
okay, did you remember what make this pain worse?
When I am walking, like if I just take 50-meter step, and then it hurts. It really hurts.
Um, uh,
And
what
also
what
when it's cold,
what
it
what?
really hurts.
Okay, what make the pain is relief?
Oh, when I'm resting, it actually goes almost.
Okay, upstairs increase the pain or relieve the pain?
No, it's the same.
The same.
Yeah, does not relieve it.
Did, did you wake up at night is because this pain?
No, I said when I'm resting, I
Yes.
don't usually feel much pain.
Okay, does this pain affected your daily life?
Yes, when it's cold, it really affects me, and then I can't walk. I can't go anywhere much without having pain because whenever I walk, or it's cold pains.
Okay, have you had any trauma or hurt yourself
No,
this
doctor.
before?
No,
No. Any notice any skin change or rashes on your skin?
no skin change.
Any change in color, like dusky color or pale color?
No, I've not noticed any change in colors of my leg.
Have you had the same symptom before?
No, this is my first time.
Okay, I want to ask you some personal questions, if you don't mind.
That's all right.
Do you smoke?
Yes, I do smoke a lot.
How many cigarettes a day?
I can take almost more than a pack per day.
For how long?
Now, I've been smoking for like 25 years now.
Okay, do you drink?
Yeah, occasionally I do.
Okay, who live with you at home?
I live with my husband.
What's your job?
I'm a teacher in school.
Have you had visiting your GP for any reason before?
No,
Have you had ever had a surgery?
no, I've never had any surgery.
Okay, I want to ask you some culture related other
That's
system of your body. Have you feel your heart racing more than
no,
normal?
it's
Any
normal.
chest pain?
No,
Any problem with water work?
no, I have no problem with my other works.
Any tummy pain or change of your bowel habit?
No, that's nothing.
Any pain or numbness in your body or limbs?
Yeah, I felt like my limbs have been a bit numb, but I don't think it's necessary. I think a bit.
You mean you have numbness in your both legs with this pain?
Yeah,
Okay. Any headache or
no headache.
okay, have you had any idea what may be the cause?
So that I actually don't know what's wrong with me. That's why I am here for help.
Have you had any particular thing you are worried about?
I want to know what's wrong. I'm just 43, and then I'm having this severe pain from my back to my leg. So it's actually, and then I can do anything. Just walking for a short distance, I feel pain. So it's really annoying.
Sorry, I forgot to ask you, have you had any fever?
No fever.
Okay, thank you.
My pleasure.
I take a history from lady. She's 43-year-old. She complained of back pain and related to both her legs.
Yes.
Decrease with walking, decrease with rest is not related to up, down, or downstairs. Associated with numbness, there is no skin change or skin rashes. There is no history of trauma. The patient is smoking 20 cigarettes per day for 25 years and drink occasionally. There is no history of any previous disease or surgery. Other related system is he is well and fit. Top of my differential diagnosis is could be related to neurological disc prolapse or nerve compression. It could be vascular related to chronic ischemic vascular. It could be joint pain, hip or knee or back pain.
Okay. How would you differentiate between spinal or vascular claudication?
Neurological and vascular claudication. The vascular have a fixed stand, is increase with walking, decrease with rest. There is a history of heart or previous any vascular. There is a change of color of the leg with the pain. Neurological increase with downstairs, relief with upstairs or bending forward is relief, the pain relief with sitting down. There is no any skin change or history of vascular problem. The this is different
Yes.
according to the
And there'll
vital.
be numbness in the limbs. Okay,
Yeah,
can you please tell me how should this patient be managed?
a patient should be full examination, send investigation in terms of lumbosacral X-ray, MRI, and vascular Doppler duplex may be need for CT scan angiogram.
Yes. And treatment should
And
be?
management with conservative
Yes.
physiotherapy, stop smoking, control blood sugar, hyperlipidemia, and if the patient can't tolerate this for conservative period, is surgical intervention after
Yes.
consult neurovascular if the cause is vascular, or spinal surgeon with spinal problem.
Yes. Okay, good. 13 seconds left. Good, thank you.
Thank you.
Yes, you covered within given time and you covered all the related important topics. I see Dr. Abhishek has joined. Would you want to give feedback? It was good, yes. Yes, anyone else want to? Dr. Fatimata, would you want to give feedback?
Hello, ma'am. How are you?
Hello?
Yeah, actually he did very well. So he had to jump, like yesterday you were explaining that if you know the time is against you, because he didn't even ask me about the severity, but you could go to the eyes and the rest so that you can score your points. So for me, he
Yes.
did awesome. Yeah, he really knew what he was doing.
Yes. Yes, Dr. Abhishek.
Yeah, actually, ma'am, he did. He tried to ask all the relevant question, but for in here, actually, my focus is to guide, be more live, like hearing patient's emotion. Just don't say I'm sorry, but like your body language, like it will be good, definitely in real scenario and real station, something like that. But whenever you talk to the patient, like try to hear. She was just like, you asked a couple of questions, right? She was not getting, like whenever you ask about the nature of the pain, give her some option and everything. So yeah, so what is the patient saying and you are getting it and you are just throwing the counter questions, that actually matters in communication. Other than you asked most of the questions, and definitely you acquired a good marks definitely in this station, but like try to improve, that will help.
Good. Okay.
Yeah, ma'am, that's from me.
Dr. Sirizat wanted to say something.
No, ma'am. Just I think Dr. Abhishek directly said exactly, and just a small side point to Dr. Said. There is a small point. I mean, there is a mark for empathy as well. So this is a good
Yeah,
station where we can actually say, "Oh, I'm so sorry to hear that," and
Yes.
given some dialogues which basically will say or will show your empathy towards a patient, because there is
yeah,
one mark for that as well. So when you start, I mean, because there's pain in this patient, about pain as a presenting complaint, you can start off with, I understand that you're having some leg pain, do you like some pain relief?
yeah.
Or
In
when
every
the
pain
patient
relief
says that
station,
my
that's it.
presenting complaint,
Yeah.
when the patient says that my
So,
presenting is because of my leg pain, I can say, well, you can say, I'm so sorry to hear that. Can I ask a little bit more about it? All these small dialogues, which will give you one more mark for the empathy section as well.
Yes.
that's like in every pain related station, you can offer analgesia. Okay, and then you will realize that patient will say that please proceed. Then we can go for that, something like that.
Yeah,
But
even in
it
my
will
station, I
definitely show
forgot
your
about that.
empathy. Yeah.
Yeah.
Good. Yes. Thank
Thank
you.
you.
Thank you.
Thank you.
Said it's okay.
Yeah,
Yes. Okay. Timer has been started, and here is your question. If you have read and understood the question, kindly begin your history taking session.
Hello, I'm Dr.
Yeah.
Jay, one of the surgical residents. May I please confirm your name and age, please?
Oh, yeah, doctor. I'm Sarah. I'm 53 years old.
Hi, Sarah. How are you?
Uh, no, I'm just a little bit sick, I guess, doctor.
Oh, so sorry about that. So
No,
what brought you to us
okay.
today?
Sorry?
So what brought you to us today?
Oh, yeah, actually, I had some kind of, I lost my consciousness like a day before yesterday. And that's why, and after that, I am having like a lot of headache. And that's why my husband actually brought me here today.
Oh, so sorry about that. So, when did you say the headache started?
uh after that episode of losing consciousness, and my husband also noticed that my body was shaking. Yeah, after that I'm facing it.
Okay. So, do you need any medication for the headache, please?
No, it's okay, doctor.
It's
Just
all
you
right.
figure. Yeah, if you ask anything.
Okay.
Thank
So,
you.
you're welcome. So, which part of your head hurts more? Where do you feel the headache? In front?
It's like centrally it's just grasping my head.
Okay. So, is the pain sharp or dull or
It's a kind of throbbing pain, and
short?
I'm just, whenever I'm nodding my head, I'm getting it.
Okay. So sorry about that. So, have you been
It's okay.
vomiting with the pain?
Sorry.
So, anything that made the pain come more
Oh,
or
okay.
less?
I took the Odyssey paracetamol drug, and it just lowered it to some extent. Then I again got it.
Okay, so when you the pain stops in the center and then does not go anywhere else, or it just
No,
somewhere else?
it doesn't go anywhere. Yeah, and the mostly sometimes in the neck also.
Okay, so from the pain score, if I say 1 to 10, 1 being the lowest and 10 being the highest, how much will you score? If you're telling me
Okay,
about,
right now it is 4, doctor, and sometimes I have about 7 to 8.
okay, so sorry about that.
Yeah,
So
thank you.
has it disappeared at any point, the headache, or it has always been there?
It's always there, doctor, and just I have told you, taking paracetamol, it just decreased. It was just decreased to some extent, then again came back.
No, so sorry about that. So have you been having any vomiting lately?
I vomited once after that, doctor.
Vomited.
After that, after losing
Okay,
consciousness.
did the vomiters did it have any thing inside it? The color, was it blood or it was just
It was just kind of some food particles I have taken lately.
okay? Have you been feeling dizzy?
No, doctor.
Okay, you have not been feeling. Have you been feeling like or weakness like your legs or hands being like numb?
A slight weakness in my right leg, doctor.
Okay.
I feel it.
Okay, so you said you lost consciousness
Yeah.
before coming. So about let's talk about that consciousness. So it's like, did you feel anything before falling?
Yeah, I was feeling some kind of anxiety and some kind of visuals, and then I got it, doctor.
Oh, so sorry. Okay, so
Yeah.
when you fell, did you have anything like were you shaking all over or it was just a normal fall?
Okay, I don't remember, but my husband told me that only my right hand actually was shaking.
You were shaking. Okay, but did anything come out of your mouth? He didn't tell you about that as well.
No, doctor.
Okay, so how long were you gone for? He didn't say like how long were you unconscious for?
It's about 2 minutes. My husband said.
Okay, so did he tell you about your water works? Were you able or were you passing urine or you lost control of your barrel as well?
No, no, no. That was perfectly
Oh,
fine,
it's
doctor.
perfectly fine. So I'm going to ask you more about your medical, your health, general health. So have you ever been
Yeah.
admitted before?
Yes, it's the second time. I had it 6 months back also,
6 months
doctor.
back, the same.
Yeah, same.
Okay. Have you been on any medication for it?
No, I didn't go to doctor. I was just saying it's normal. Yeah.
Yeah. Any history of hypertension, diabetes?
Yeah, I have hypertension and I have something called the multiple cyst in my right, both kidney.
Okay.
Yeah, so I take antihypertensive medication. I don't remember actually the name.
Okay. So do you are you on any drugs?
Yeah, for that
For that?
hypertension, I am on drugs, but I don't remember the name. I'm really
Okay.
sorry.
Okay. Any allergies to any drugs?
I'm allergic to penicillin.
Penicillin. Okay, that's all right. Have you had in your family? Does anyone have the same symptoms?
Yeah, my maternal aunt actually had this, and she had a stroke, and unfortunately, she died
Oh, so
four
sorry.
4 years back.
Okay, so sorry about that. So, do you have any fever,
No, no, doctor, I don't have.
chest pain,
No,
any leg pain?
no, no, doctor.
So, what's your work?
I actually work as a school teacher.
Is that my alarm? Oh, yes.
Yes.
Okay, thank you so much, Doc. Thank you.
It's okay, doctor. Thank you so much.
Can you present your case now, please?
I would have loved to complete my history with asking the patient about his idea, concern, and then expectation
Yes.
before presenting. So I present a 53-year-old female that was brought into the A&E by the husband on account of loss of consciousness, and then but then regained consciousness later on. So with associated severe headache, vomiting, with no post-ictal sleep, but no loss of bladder or bowel control.
So what are your differential diagnosis that you're going to consider?
So thinking that maybe patient has a seizure attack with possible subdural hematoma. Maybe.
Okay.
Uh,
What other differentials are you going to consider?
So I'm going to consider any lesion, brain lesion. Maybe it's a brain tumor, or it's a maybe it's a stroke, or
Okay.
maybe it's an infective cause as well.
How do you plan to manage your patient?
So I'll manage my patient by doing a full neurological examination, and then to also start investigating, doing the full workup to see if there's any leukocyte level, making sure that I do a brain CT scan. If there's no contraindication for lumbar puncture, to do that. Also do an EEG actually
Yes.
for the patient to know the electrical function of the patient's brain.
Okay. What are the treatment options that you can offer your patient?
So depending on my finding, if it's an infective cause, treat the infection. If it's due to seizure attacks, and then because this patient has a family history, so I will put patient on anti-seizure medications, oral medications, to see if that will stop the patient from having the attacks, such as sodium valproate, carbamazepine, or any other anti-epileptic drug. And also, if it's due to hematoma in the brain, to evacuate it if it's necessary.
Okay. Good. Right. Uh, Dr. Abhishek, would you want to give feedback first?
Yes, ma'am, definitely. Dr. Fatumata, last time I heard you, you have improved much.
A lot.
Okay, I'm
Yes.
really, but yeah, you improved a lot. And the fact is, in this station, it can be a focal seizure, it can be a generalized seizure, and it may be due
But
to
this was headache.
it-
Seizure is another.
This one,
yeah,
I
yeah,
was confused
yeah.
what it was.
This was headache.
This was
Yeah.
headache, but I think he
Hello.
mentioned seizure as well.
Yes,
Yeah.
so
Yeah.
I was here, I was there, so I was like, okay, let me just
Ma'am, there was loss of consciousness, and
Consciousness,
I
and
don't know.
then she
Yeah,
woke up with a headache. You know,
yeah.
yeah,
she
yeah,
was
ma'am.
complaining of
But
severe.
I actually granted this station about that this seizure, and after that
Seizure is
she lost
different one.
consciousness. Yeah,
Yeah,
ma'am.
in that she passes. She has aura, and she passes.
Yeah. She asked
Clinical.
about regarding anything,
Yeah.
but just to think about this station, you should ask about this weight loss and appetite, because it could be a brain tumor. And other than this, you have asked everything, I guess.
Yeah.
And that's from me, actually, ma'am.
Yes, she forgot the
The
history of
timing is
trauma.
always
Timing, okay,
yeah.
she
Yeah.
couldn't follow, but then she covered it up at the end by saying it that she has missed
Yeah.
what other part. Okay, she because it was headache and patient lost consciousness, so she should have asked if you remember hitting your head.
Hitting head, yeah.
Yeah, so trauma kind of is important. And then one thing, Dr. Fatumata, what is the difference in subdural hemorrhage and subarachnoid hemorrhage?
In clinical presentation or
Yes,
imaging?
clinical presentation in history taking.
So
So how would you know which one is which? This is very important because this is the big blunder you did. You said it could be subdural
yeah,
hemorrhage. It cannot be until
yeah,
unless patient has
subdural.
had trauma first.
Trauma history, yeah.
In
Yeah, so it's
subarachnoid hemorrhage, it can be sudden. Patient is
sudden,
not,
yeah,
yeah.
especially with patients with brain atrophy, elderly, and
Yeah, it
yeah, so
doesn't
they can,
have to even have to be elderly because here patient is giving
yeah,
history of
atrophy
polycystic kidneys. So patient can have aneurysm and all of a sudden patient can
can
have
have it.
severe throbbing pain and hemorrhage and yeah. So difference, knowing the difference, clinical features or the symptoms, how the
Okay.
patient will present is very important. And this is very important not to say the wrong in present while presenting your case, otherwise whole thing will be sabotage.
That's true. Okay,
So
that's
this
good.
is very important
That's true. That's true.
from me, yeah. Because once you're saying your differential diagnosis, then you have to justify them as well, and you have to say them very thoughtfully.
Yeah. Okay.
Yes.
Okay.
Anyone
Thank you
else want to
so
give feedback?
And ma'am, the last thing from me, like about the management, definitely mention about the neurosurgical team or
Yes.
multidisciplinary team.
Yes.
You can say that. Yeah.
Yeah, you can add that as well.
So I have to inform the neurosurgical team.
Yeah.
Yeah. Yeah.
Okay.
Your MDT. Yes. Okay.
MD.
Anyone else want to give feedback to Dr. Fatimata? She's getting well. She is covering, like, she's learning a lot.
Yeah, I
Yeah,
am.
yeah,
I'm
she's
actually have
very nice, quiet, clear voice,
Yes.
cover everything. Yeah.
Yes. Good.
I think maybe one thing that she forgot, I don't know if she asked a fever history. Like,
She
yes,
did.
I did.
She
maybe
did.
something that she
She
forgot.
did
She
ask
asked.
favor.
Yeah.
I
About
asked.
Yeah.
fever lately.
She forgot and then she remembered and then she asked. She
Yeah.
covered that. It was just a trauma, and then all of a sudden when she said subdural hemorrhage, I was
Yeah,
thinking,
you know,
what?
in my mind, actually, that's extra
She
dural.
didn't
You know,
even
when
ask about the trauma, and all of a sudden it's subdural.
yeah,
How could that be?
Yeah.
Anyway, it's good learning. Yes.
She, she she know that when he said I have a cyst in my kidney.
Yes.
Oh yeah,
yes,
she remember, yeah, subarachnoid.
I
She
know.
she moved very slowly with the seizure after he said kidney cyst. You stop and start again.
I know.
True. Good. Thank you.
Thank you.
Yes.
Yeah.
Okay, started the timer, and here is your question. Yes, here is the question. Yes, if you have read and understood the question, kindly begin your history taking session.
Hello, I'm Dr. Kamara. May I confirm your name and age, please?
Hi, I'm Lois. I'm 67 years old.
Louis, nice to meet you.
Hi.
Louis, I'm asked to take a history from you today. Is that okay with you?
Yes, please.
Yeah. Can you kindly tell me what brought you here today?
So, doctor, I had an episode. This was actually noticed by my husband. I had apparently lost my consciousness. I had fallen down and I was shaking all over my body. This happened once before as well. And today, now this morning, I had the same episode. So yeah, I've come for that mainly.
Oh, sorry about that. Yes.
Mhm.
So you said this happened when? How many hours ago or how many days ago?
This morning, about maybe 4 hours ago.
4 hours ago.
And yeah.
Okay. Okay. Do you know how long does the convulsion last, or loss of consciousness last?
I don't really exactly remember, but my husband said it lasted, I think, maybe a couple of minutes. I lost my consciousness and I was fallen on the floor and I was shaking all over.
Okay. Do you know when you fell down, like whether you hit your head on the ground or any solid organ?
Again, he didn't say that. I mean, it doesn't look as if I tripped on anything or something, but I just, like I said, I lost my consciousness. I fell on the floor. I don't remember the event completely at all. But this was noticed by my husband who was with me at the time.
Okay, that's fine. So before you lose your consciousness, do you have any symptoms that you can explain to me?
Not really. It was fine. I was just walking to the grocery store.
Okay, and then this happened, right? Okay, was this associated with any fever?
No, I didn't have any fever. No.
Okay, was there any fluid coming out from your mouth?
No, but I did wet my clothes. I did pass urine during the event.
Okay,
apparently.
okay. So was there any inability to control your bowel movement at this point of time?
No, I didn't pass any stools, but I did pass urine.
Okay.
Yeah.
Okay. So is this the first time you have this kind of symptoms?
No, I had one episode similarly. This was about a month back. And after that, this is the second time it's happened this morning. So it's concerning me.
Okay. So you made mention like you were shaking. So I want to know, was it all your body shaking or part of your body that was shaking?
No, it was apparently the entire body. I was shaking vigorously.
Okay. Entire body. Okay.
Yeah, it was entire body.
Okay.
Yeah.
Okay. So can you recall any events that happened before this thing, before your convulsion or before your shaking?
Well, like I said, the last thing I recall, I was actually walking towards the grocery store. But other than that, I don't remember anything else. And then I was on the floor when I woke up.
Okay.
Yeah.
And I want to know, was this associated with any severe headache? Any headache?
No
headache.
I didn't have any headache. No.
Any stiffness of your neck?
Not really.
Not really.
Doctor, no.
Okay. Do you have any weakness of any part of your body?
No.
Not exactly. Okay. I want to ask you some few general questions. Do you have any chest pain or difficulty breathing?
No.
And any constipation or diarrhea? How about vomiting?
No, doctor.
No vomiting.
No.
Okay. I also want to know whether you have any discharge coming from your ears or eyes. Not exactly. Okay.
No.
Do you have any chronic medical condition?
Yes, doctor. I'm taking medication for my diabetes and my blood pressure, but I don't remember,
the
names
names of medication. Okay. Do you have any family history of any medical condition?
No, doctor. No.
Okay. And I want to know if you have any previous admissions.
Sorry, previous
admission. Were you ever admitted in a hospital?
No, I was never. No, I was never.
Do you have any previous surgeries?
No.
Exactly. Okay, I would like to ask you some few questions about your personal history. Is that okay with you?
Yes, please.
Do you smoke?
Yes, doctor, occasionally, but yeah, I do.
How much do you smoke?
Maybe less than, maybe 2 or 5 cigarettes a
2 or
day.
5. And how long
Yeah.
have you been smoking?
It might be over 20, 25 years
25
now.
years. Do you take any alcohol?
Occasionally, I drink the wine occasionally over the weekends.
Okay. Are you physically active?
Yeah, I can get around on my own. I walk to the grocery stores and everything. Yeah, I'm fine on my own.
Good. I want to ask you a few questions about your social life. Are you married?
Yes, I have a husband. Yeah, I live with him. Yes.
Okay. And who do you stay with?
With my husband.
Okay. What's your occupation?
I'm not currently employed. No, I'm not working.
You're not currently employed. Okay, that's good. Do you have any idea of what is happening to you now?
Not really, doctor. So I have no idea actually what's happening. That's,
okay, and then do you have any concern that we can address today?
No, there's just mainly there's episodes that keep on happening to me, and I have no control over my urine and everything. It's really embarrassing, so I'm really concerned about that.
Okay, okay. So, and is there any expectation that is there anything that you are expected from us today?
Yes, definitely. I mean, I want you to find out what's wrong with me. I mean, like I said, this is really concerning me right now.
Okay, and I still want to go back and ask you a few questions that and about your general status. Is that okay with you?
Yeah, please. Yeah.
How is your appetite? Do you have any change in your appetite?
No, I mean it's fairly been the same.
The same, and
not
okay. And then do you observe any weight loss?
No, not really. No.
Not really. Okay, that's good.
No.
So I quickly want to go over what we just discussed. Please let me know if there's anything that I may skip. Okay.
Yeah.
Is that okay with you? So you said that you had an episode of fall. You fell down, and then which was followed by general shaking of your body. And you had a previous one about 2 months ago, but the last one today happened about 4 hours ago. So during this episode, you had
the last episode was one month ago.
Yes, last episode. Sorry, 1 month ago. Okay, that's fine. Yeah. So during this episode, you were not able to control your bladder, but however, there was So and then you are concerned about what has been happening to you. So you are here on consultation to address that problem. Is that what we discussed today?
Yes.
Okay, that's fine. So we will do thorough examination for you, and including your central nervous system. That means we'll check all your limbs, and then we'll check every part of your body, and I will discuss with my consultant. So we will know what to do for you. Is that okay?
Thank you.
Thank you so much. Yes. So do I?
Wait. Can you present your case now?
Yes, I present a 67-year-old lady who was brought to the emergency with complaint of 2 episodes of fall down with a generalized convulsion, and then during which she had a loss of bowel control, and she's a non-diabetic and hypertensive on medication, so currently being controlled. So she's concerned about what is happening to her. That's why she presented to the emergency for consultation.
So what are your differential diagnoses for her?
Differential diagnosis could be one, I will think of a seizures disorder, such as, could it be an epileptic attack?
Okay.
One. Differentials would be, another one would be, could have been diabetic ketoacidosis. She's a non-diabetic patient.
Okay.
And then another one would be stroke. He's a non-hypertensive diabetic patient too. And another difference would be, could it be a space occupying lesion such as brain tumor?
How do you plan to manage this patient further?
First, I will do thorough examination for this patient, including central nervous system examination. And then I will do brain CT scan for her, or even brain MRI. I'll also do blood workup such as blood sugar, urea, electrolyte, and creatinine.
Yes.
I'll also do full blood count for her. And possibly I'll do EEG electroencephalogram And
What treatment option can you
yes.
offer her?
It will depend on the findings of investigation. If this is a diabetic ketoacidosis, even the epileptic crisis, obviously I'll manage medically with anticonvulsant.
Yes.
So if it is a brain tumor, so depending on the size of the tumor and then the stage of the tumor, she may need a brain surgery that to remove the tumor. If it is stroke, then we'll manage medically too. And another differential I forgot could be subarachnoid hemorrhage, but in this case, it's very unlikely because there is no severe headache. So in case if it is subarachnoid hemorrhage, we'll do neurosurgical intervention. I will discuss with neurosurgeons too. I forgot to mention that. That's what I've been at the top.
Okay, good. Thank you. For me, you have taken, definitely it was your first time. You didn't know. So when the first bell went, you should have just completed it and it should have presented the history, but then you just remembered all of a sudden patient's appetite and then you went on and then you summarized the whole thing to the patient. That kind of wasted 2 extra minutes that could have been saved.
Actually, the second bell was not, audible, ma'am. I don't know if it was the same
It
for
was,
the others,
yes.
I couldn't hear
I
also,
couldn't
ma'am.
hear too.
but yeah, I couldn't hear, ma'am.
Yeah, I
None
could
of
not.
you
Because I
did.
was also wondering how did he get
Yeah.
chance
I
to
could not hear
summarize
that
it to
I
me
didn't. I didn't
first.
hear at all. I was like, the bell.
I was wondering
Amazing.
how is he getting time to summarize it to me in the first
Yes.
place.
Yeah,
Me too. And I was
Exactly. So
no, actually, you go back and you listen, and it was audible. I don't know. Maybe you were so much engaged with each other that
No,
you
no,
didn't.
ma'am. It was not audible.
yeah.
Even when
that's when
Dr.
it
Fatima
was
was presenting, it was not audible.
Yes, but she could hear hers. So
It
this
was
one
very
as well.
lightly audible.
Yeah,
Okay.
so I did not hear the bell, so that's why I don't know what to do. Then I
Okay.
have to go ahead and start summarizing to him.
So that's good. So in
Yeah.
this one, you have to take history in 3 parts.
Yeah,
Aura,
before the
the
event,
first
during
one,
the
and then
after the
during the event, and then after the event. So
Okay.
was there anything he missed?
Ma'am, he asked about the headache and everything, and aura, and he asked what if was there anything that you noticed before the event.
and
He could have detailed a
post-ictal,
little bit more on
Yes.
post-ictal and during the as to how did your
During
husband
the
describe it?
yes, how
Did you trip on
what the
something?
witness
Did
says,
you
and
hit your head first,
if you
or
bite your
where exactly?
tongue,
Yeah, did you bite your tongue? Yes, and do you feel any musculoskeletal pain in the
the
post-ictal
pain exactly.
history?
and
And
triggering factors also, I guess, like was there any sleep deprivation, alcohol withdrawal, or any
Or
drug?
chest pain or
Sleep can do
anxiousness or yes, any
chest pain,
fear.
anxiousness. Yeah,
yeah, but
Yes,
he did
so
very well.
yeah, he did
considering
really very well. I think, yeah.
it was his first time with us.
Yeah.
It was
Yeah.
amazing.
Good. And he was even asking about the idea concern and
Yeah.
okay, good. Thank you.